My research interests are focused around two key topic areas. One is around ageing and later life, and the other key theme that I've worked on over my research career is in the broad area of public health, particularly around health inequalities and behaviour change. I guess the two areas intersect in many ways. So one of the key themes that I started out looking at fairly early on in my career were inequalities in health status amongst older people. So it's well established that there are quite profound inequalities in physical, mental health and also mortality for people aged under 65, and those reflect people's social position but also gender. But there was very little work done looking at whether those inequalities persisted into later life. So one of the key interests I've had across my career is looking at how those inequalities play out, looking at how we can promote health for older people, and my particular interest has been around encouraging people to become more physically active, not in terms of sending them to the gym for heavy workouts or making them run marathons, but by working on a number of studies where we've had a very simple intervention, so getting people to walk daily, looking at loneliness and isolation in later life. So how prevalent it is, what the consequences are, how it's changed over time, and what we might do about it. So those, I guess, are the three areas where I've spent most of my working life. I work as part of a multidisciplinary team most of the time, so I work with public health practitioners, I work with general practitioners, I work with health economists and other social scientists. The work that I worked with my colleague Tess Harris and others down at St George's Hospital in South London, I think has been fairly influential in being the first intervention trial that's demonstrated, first walking intervention trial that's demonstrated not just short-term increases in physical activity, but actually that we can help people to sustain those improvements. My work, along with a number of other scholars, was influential in founding something called the Campaign to End Loneliness, and is currently, I think, at least contributing to the debates about loneliness and what we should do about it, and what the Minister of Loneliness should be doing about it, how we should follow up from the Joe Cox Commission recommendations. But of course, we talk to the government, whether they listen is quite another thing. So certainly working at Brunel has given me opportunities for new collaborations with our colleagues who have an environmental perspective, as I think potentially ageing and inequalities generated around climate change and environmental action are going to be perhaps an interesting research agenda. And the other groups that I've had the opportunity to work with at Brunel, and it's been really fruitful, are colleagues in design. So thinking about not just for older people, but how products, services, our housing and the wider environment can be made accessible for people of all ages. I think there are a number of really interesting research questions that could be addressed by research students, and I hope to have a couple of opportunities in the near future. One is potentially on a project looking at caring by amongst older people from Asian heritage, but looking at male carers. So when we think about older people and families from India, Pakistan, Bangladesh, we assume that caring is done by women and typically the daughter-in-law. Some quantitative work I've undertaken has revealed that there are a significant proportion of male carers in those groups, just as there are for the general population. I've got access to a very large survey, and I mean very large, and there are a lot of qualitative data that is unique and has never been analysed before about how people understand loneliness, what they think can be done to prevent loneliness. And the question that's interested me for years is, what's the opposite of loneliness? So there are lots of really interesting questions there. And the third area where I would be looking, I think, for perhaps potential PhD student is around people ageing with a learning disability. So we know we know more about older people, so parents caring for adult children with learning disabilities, but we know very little about the experience of ageing for people with learning disabilities themselves, and I think that's potentially a really nice topic for a PhD student.